Welcome back and thank you for staying with us. Of course, we begin our conversation straight away talking about the war against alcohol and drugs in the country. And I told you this is a household problem. Somebody in your house or somebody you know or somebody close to you, somebody in your community is a victim of this particular menace that we are discussing this morning. And it's a conversation that involves all of us. The good thing is that you have a role to play and you'll be finding out how, if you are a stakeholder, a caregiver, a parent, a young person, each and every person has a role to play in finding solutions to this menace. And we have a panel that will be engaging us on how best to get there. And I'll just run you through who we have in case you're just joining us for the sake of those of you. And beginning from my far right, Edward Wanyonyi, security analyst and researcher. Asante for creating time.
Thank you.
We have with us also Dr. Anthony Omerikwa, the CEO of NACADA, the National Authority for the Campaign Against Alcohol and Drug Abuse. Karibu. And of course, Nkatha Mwenda, a recovery coach. She also chairs Graceful Youth Recovery Center. Thank you. And we have with us Boniface Ndirangu, Director, Eden House Foundation. Asante for creating time. All right, so maybe it's always good to begin, and I'll begin with you, CEO, by painting a picture of the scope of the problem. There's usually, NACADA does a lot of, surveys on the ground and regular updates come on what numbers we are at. I don't know from your analysis, if you look at how the graph is looking like, you tell us whether we are making progress. But what I'm more interested in is understanding the depth of the crisis in terms of numbers so that we can begin to unpack it from an informed point of view. Tell us a bit about the key highlights of your latest figures.
Thank you very much. First of all, I'd like to thank His Excellency the President for acknowledging and telling Kenyans that alcohol and drug abuse in this country is a threat to the survival of the country. And because of that, it has become part of the country's grand strategy to ensure that the nation saves its people. Now, the graph is very steep. If we take a look at five years back and compare it to now, I think we are in a dire situation as a country. Just to give you a perspective, 1 in every 7 Kenyans is abusing alcohol. If you compute those numbers against a backdrop of service delivery in the public service, the strain it brings to our health system, the lack of productivity in general. There's a clear correlation, and we've done an analysis between road traffic accidents and drug and alcohol abuse. So this issue is an issue of concern. And,
1 in every 7 hours, just looking at who we have in the room, and I'm wondering.
And I'm very specific, 1 in every 7 between the age of 15 and 65. Those are the metrics we normally use because we assume that the average commencement age of drinking in the country is 15. That notwithstanding, the youngest addict through our normal rigors of work and research was aged 7 years old.
7 years.
7 years
That's
old.
An addict, not just
somebody. Yes, an addict.
Yeah.
And interestingly, this scourge does not discriminate. It doesn't care about profession. It doesn't care about age. It doesn't care about gender. And I'm saying this to say that a couple of years back, the male gender dominated these statistics. But in the recent study that we did across universities, and I want you to bear in mind that the most elite demographics, the university students are the elite within the demographics of the youth. Yeah? And the number of substance use amongst ladies and men within that category nearly balances out. So just to highlight is that over time, the females have also come up as users and abusers of alcohol and drugs within that demographic. And unless this scourge is nipped in the bud, I think it will come at a very big cost to the country. Yes.
All right. We'll talk about the cost and the implication. I think I should go there, and let me come to you, Nkatha. If you hear what you know, the CEO is, the picture he's painting in terms of the magnitude of the problem. And even talking about the demographics are currently changing. The females seem to be catching up, not in a good way. What does this tell you? You've been in the system, you've dealt with people who really almost were on the verge of falling apart. Some even fell apart. And we just want to hear from you how you interpret the numbers, put it in terms of impact from your perspective.
Oh, thank you so much. I'm glad to be here. And a recovery coach is somebody who has gone to rock bottom. And so I've walked that journey. And we are working with people in the community to offer recovery support. That's the peer support. And so those statistics are alarming. And what I can say is it is great that the president is steering this campaign to address alcohol and drug abuse. Enforcement is welcome, but we need to also incorporate the persons in recovery. What I've heard being spoken about is supply suppression, go for the suppliers, and even introduce treatment in all counties. What happens after treatment? You know, these people go back to a community where they're stigmatized. That is the reality. Many people who are in recovery or have a substance use disorder, which is that addiction, have lost a lot. So when we look at these statistics, it is horrifying because when it affects the economy of a nation, it affects families, it affects productivity, it affects everyone. But are we looking also at that individual? You know, what this person after, you know, this person who is in recovery from addiction, sometimes they don't have opportunities. And we're saying this is a resourceful group of people, so that as we are doing enforcement, we are also looking at recovery capital. We are looking at these people as being resourceful and also offering opportunities after treatment. So on the ground, it is hard. It is hard on families, it is hard on the children, it is hard on the youth, and it is most hard on the women because there's also more stigma, there's more isolation there, there's more shame, even as a woman, as you've asked that question, how is it to the woman? They're the ones who are hiding, you know, and yet everyone looks up upon them. When a woman is in addiction, I tell you, the home breaks. Yeah.
If they are not the ones who are using or abusing these drugs and alcohol, they're actually also victims of, even if the men are abusing. You've had cases of abandonment, you know, the head of the family is nowhere to be seen because of alcohol. So it cuts both ways. And I like how you've looked at the whole spectrum of approaching it. I'll come to you shortly, Boniface, but let me hear from Wanyonyi a little bit. There is a bit of nexus between alcohol and drug abuse and security. The other day, the CS for Interior, Kipchumba Murkomen, was here for an interview, and he spoke very passionately about, he ranked some of the serious security threats in the country, including terrorism, banditry, and alcohol and drug abuse was among the list that he gave. And I want to hear more about, people don't look at it that way. We see drug abuse and alcoholism as more of a social issue, more of a spiritual issue, but we are never really looking at it in terms of how it affects the status and the stability of our security. Maybe you can help us understand the nexus in this.
So thank you. Drug and alcohol abuse come into the security nexus because, one, for a lot of the fact that we have actually criminalized this aspect, you'll find that there is incentive to actually trade in it because the margins, it's not a regulated area. So the margins are there. So for people who are actually, you know, doing the supply, who are doing the distribution, who are getting and looking at that as a profit area, they are able to think around this informal market. You know, there are no checks and balances. So they are able now to go into this space. It's an informal trade. That is number one. Number two, you find that there is global appetite, and in terms of the distribution, you'll find that, I mean, we have been known to be, you know, in a space whereby quite a number of spaces, times or contexts we have had to be transit. You know, drugs have passed through this country. So there's the global trade in narcotics. There's a global trade in terms of illicit and counterfeits. Then number two, also you'll realize that for most people who are engaged in crime, most of them, they will always abuse, you know, these substances, you know. There is a very strong correlation between crime, disorder, and alcohol and drug abuse. And at the same time, you also see that in spaces whereby we are doing pre-exposure to young people, that means these are going to be long-term customers. And it's unfortunate, you know, to look at it that way, you know, because once the young people are addicted, if you're talking about the numbers the CEO is giving us, you know, what is the whole spectrum by the time the person gets to 65, you see? So there is an issue to do with the normal issues around crime and disorder and how, you know, alcohol and drug abuse actually compounds that effect. There's also the issue to do with just the entire transnational trade, because alcohol and drug abuse, you'll find issues to do with human rights, human trafficking within that space, you know. And then, of course, at a social level, I mean, alcohol and drug abuse has been linked to, you know, violence, gender-based violence, battery, you know, crimes of assault are always there, you know. The CEO has spoken about the issue to do with drink and driving. So within your judicial system, I mean, one of the biggest contributors to that is people who are within this alcohol and drug abuse. That is clear. But also the fact that within our space and our context, there's a lot of, you know, illicit trade that is happening, unregulated trade that is happening. You know, a lot of backstreet kind of, you know, production of these substances that are not regulated, they're not treated. And now, and the CEO will speak about this, I'm sure, because in one of the NACADA studies you find there's a lot of what they're talking about, edible cannabis. You know, they're trying to repackage some of these things so that they're not in the initial form. You see, and that is another area of trade that has not been looked at, but actually it's criminal in nature. So that nexus has actually been established.
All right. And the area you have taken us to is, I think the government is going big now on the people who are involved in this, the illicit trade around alcohol and drugs. And I want now to bring in Boniface on this. First of all, what's your thought about the strategy that the government has been, you know, using until now that we're having this conversation towards a new direction? What do you think of the strategy that we have been using as a country to deal with this menace?
Oh, thank you, and thanks for having me.
Very well.
And thank you for the panel. I have no doubt that the new focus is very welcome, and we thank the President for this, and we thank the media also for this highlighting of this issue. For sure, in 2021, there's an MP in Parliament who asked about what the focus has been by NACADA in the last 20 years of its existence with regard, and if you like to know where the focus is, you look at where the money is being spent, yeah? And you will find that by the year 20 years, when NACADA was celebrating 20 years, we had only about very little in terms of demand reduction efforts. NACADA has been very big on prevention, which is really good. But majority of the treatment centers, almost 95%, are run by the private sector. It is very welcome, therefore, to hear the President talk about the 47 counties developing treatment centers. Unfortunately, a lot of times this money goes into hardware rather than the software of addiction.
And I wanted to simplify that for our viewers. When you're talking about demand suppression and, you know, supply, you know, let's talk about those terms and why the change of strategy is necessary.
Yes, and you know, this is a global thing, yeah? In 1961, we had a convention around the world, and many countries signed this convention, a single treaty. Supply suppression, narcotics were a problem. We were just from World War II. 1971, psychotropic drugs were becoming a problem. The whole world focused on it. 1988, money laundering from drug and narcotics trade became a serious issue. 1998, the first UN General Assembly ratified supply separation, and they developed even Interpol to follow through with people who are using. But in the year by the year 2016, these 30 years of spending so much money on supply separation began to look like not very well invested. Somehow, without a corresponding effort towards reducing demand. Supply is, it's economics.
Yes.
Yes, basic economics. Supplies meet demand. There are quite a number of drugs in Kenya right now which are available, but because there's no demand, they are not being consumed. Yeah, demand is what people are asking for. There's some drugs they don't even know the market still is not ready for. Now that is where the government really checks in to reduce, like what you just mentioned about marijuana being put in food, where tobacco is now being made into vapes. Yeah. So the supply separation and demand reduction have to go hand in hand. Yeah. They really have to go to it. The law enforcement of laws, cutting out the availability is the role of government.
All right.
But in demand, we really haven't invested much.
We have not gone that direction.
We have spent very little on.
And I know you have some insights with regards to the direction we want to take as a country in terms of just balancing those two aspects of fighting this menace. We'll be talking about that shortly, and also just engaging the CEO on the same, because there's need for a change of strategy. We have to agree. We can't be talking about the same thing the same way, year in, year out. So is this approach the best approach? And also you can tell us wherever you're watching us from at Citizen TV Kenya. Please engage us on social media. For now, we want to take a very short break. We'll be back to pick up this conversation. Don't go too far.